And Marco asked me, can you prove it? At the beginning, I thought, okay, this will be very easy. Kiddo could measure pelvic muscle contraction. So I put a balloon inside my vagina. I sit in the chair. I contract my pelvic muscles. I measure my maximum contraction. I relax, and they turn on the chair. What you could see was the chair could make 10% of my maximum contractions. And for me, okay. For me, I thought, okay, I answered the question, but it was not enough. And I started to think, where did the idea come from? Who said magnetic stimulus can make a super maximum muscle contraction? And I started to talk with the companies. The first thing that I did was, where this image come from? The answer was, oh, these are using during just a test. We never published that. So this image is not science. Okay. So I asked you, when you say the chair can promote a super maximum muscle contraction, you're saying the chair can promote more contraction that I can do by myself or force. And the answer was, no, it's not like that. What we're talking is, we're talking about muscle contraction, not about force. This is a muscle contraction that cannot generate force. As a physiotherapist, it's very weird for me, because my point of view, muscle contraction, muscle generate force. It's okay. It's no force. It's just muscle contraction. But can you tell me if you ever tested this contraction during chair stimulation? And then ask, how do you want to do this? I don't care. Just show me the muscle contraction during chair stimulation. And they sent me 3 articles. There is no muscle contraction measured during chair stimulation. This is the article. This is about central nervous system. I continue. And they told me, let me clarify. We're talking about force. Force can be torque. But in our point of view, the supramuscular force of contraction is not about force. This is about neuromuscular capacity. Okay. Did you test it? No. And the reason, the muscle contraction happens when you can stimulate the muscle more than the patient can do by himself. And do not forget, this is to be used with the patient that who has a pathology in real body and chronactia. Do you know this is to be used with patients who has any pathology? Because I didn't. And after I got this, I believe honest people always want to do the right things. Some people don't want to just show up, but we cannot forget. What we are talking about is stimulus with the frequency. So it's not about muscle contraction. This is about neuromuscular. This is about frequency. This is about nerve lesion. What is that about? I couldn't find my answer. So I thought, I will read the papers. And I started. I read 1, 2, 3. There is no reference that can say the chair, the magnetic stimulus, can make a muscle contraction. And what was very weird for me, most of the reference do not corroborate what the authors was talking. And we have no muscle assessment, They can make the assessment before and after using EMG. That we cannot guarantee there is a muscle contraction just using EMG. But the natural model was very weird. It's a mathematical model, systematic review. At the end, they said, we know, but never one tested. In science, we cannot say men can be pregnant. In your personal life, you can believe whatever you want. But in science, we need to say the truth. So, 147 articles, no evidence. I wrote a paper. I sent it for all the actors. Still not enough. We need evidence. We need science. I need to put this in the scientific articles. I wrote some letter to editors. I have it. I published it. And I thought, okay, now that I have the files, now that I have the evidence, they will believe me. Oh, it's not true. Naive, I know. So I started to get some interest messaging. Oh, this can be a defamation. Stop with this joke. And don't you think you can have legal consequences? I am just reading articles. I'm putting what I find in science. And this one was, do you think we can have fraud in science? Do we think we can have fraud in science? Terano's case, we can see papers. This is said. This is word. We can see lying in science. Today, unfortunately, we cannot trust just because this is science. We cannot trust just because we have an article. Can we have lies in science? Later, but the shares, they have FDA. Yes, this is true. The mesh hours have FDAs as well. And another interesting message, many physiotherapists doesn't like the technology. I love technology, but I like science as well. We have a lot of papers. Yes, we have a lot of papers. Doesn't mean we have the truth. What we're looking is for the quality of life of the patients. Yes, they are looking for the quality of life of the patients. Are we sure we are telling the truth for the patients? Are we sure we are being honest with the patients? Or just telling the part of the truth, the good part of truth? We are responsible for our patients. We must understand what we are doing. And today, just because we have a paper, we cannot say, unfortunately, we cannot say this is true. And I got another text message. Later, please, respect the rules. And I thought, I'm just trying to understand what's happened. Oh, this discussion is boring. Yes. It's very annoying when someone is looking for the truth. So I thought, I will try to find the definition. What's happened? What's the name in what we're doing? Oh, sorry, it's not that. Neurophysiology. What has happened with the muscles? So we have skeletal muscles and small muscle. When we talk about pelvic floor muscles, we are talking about skeletal muscles and somatic nervous system. When we talk about somatic nervous system, this is voluntary movement. And someone asked me how physiotherapy can improve renal incontinence if it's small muscle responsible for the continence. This is true. small muscle is responsible for the continence during repose. When we make an effort, we need to use skeletal muscle because the time of contraction in small muscle is too high. We need to contract pelvic floor muscle if you urge to breathe. We need to contract pelvic floor muscle if you have an effort. So the maintenance of continence is small muscle during repose, during the effort, during urging. We need to use skeletal muscle. We need to use pelvic floor muscles. How this works? Muscle contraction is the actin going to the myosin. This is a muscle, pelvic floor muscle contraction. When we have a pelvic floor muscle contraction, we have the movement, frontal and cranial. This is the only movement of the pelvic floor muscle contraction. Frontal and cranial, and includes urethra, vagina, and anus. What is the maximum contraction? This is one maximum force. And someone asked me, Lara, can you prove with physiotherapy you can maintain the contraction during 26 minutes? Guys, she cannot maintain this during 10 seconds, right? When we get the maximum contraction, we just can hold for seconds. This is not what we're looking for as a physiotherapist. What we're looking for as a physiotherapist is a global muscle rehabilitation. The first thing that you do is teach the patient how to contract and how to relax these muscles, to give them the conscience about these muscles. And after, how to use muscle agility. Because if I'm standing here and I need to pee, I need to contract my pelvic floor muscles. If I have an urgency, I need to contract my pelvic floor muscles and rush to the bathroom. So this is muscle agility. And then we start muscle hypertrophy. When I start muscle hypertrophy to my patients, we start to use the vaginal weights. The vaginal weights will promote this big force in the muscles. And what they can prove, what they can say, I can use the heaviest vaginal pumps during my exercise. So I can hold it for 1 hour, 40 minutes. So yes, we can do this as a physiotherapist, not just sit in the chair. How this works? How is the mechanism of muscle contraction? We have the information, the afferent part. The information will go to nervous system. And when this information goes to nervous system, we need to understand what you do. And you have the movement, the afferent part. When we need what to do, we will have automatic movement. If you don't know what you do, we need to learn the movement. This is cortical. And we can have the reflex movement. So, cortical is when we're learning. This is a conscient movement. Basal ganglia and the cerebellum is automatic. And the spinal cord is reflex. This is what I do with my patients. The first thing that we need to do is teach the patient how to contract, how to relax. And this is in the cortex, this is conscience. When I know how to contract, how to relax, we can start the agility. I will contract and make movement. When I start to agility, we are talking about nucleus da base, cerebellum, and practicing that, we can have reflex. reflex is spinal cord. And just as then, we start with muscle hypertrophy. We talk a lot about muscle hypertrophy, but it's not the most important part of the rehabilitation. When I start in muscle hypertrophy, my patients can start to use the vaginal weights. I don't believe signature we can find it. What we have when we try to assess muscle contraction? Today, in pelvic floor muscles, the only thing that we can assess is the maximum force. What I'm doing in the last 5 years, development pro and the methodology to understand about nerve periods, the latent period of the nerve and the muscle. Only with this, we can say about neuromuscular change in the muscles. So, if the chair wants to understand if they can promote neuromuscular change, they need this probe. Talk about the muscle assessment. There is one probe very interesting in the market. They say they can make the assessment of pelvic floor muscles 360 degrees. What is very interesting? Because pelvic floor muscles, they have a U shape. What are they measured here in the anterior vaginal wall? The answer, we have papers. You can see the results. How they can have papers about assessment of the muscle that you don't have. And we have a lot of probes. Just one channel. We cannot assess pelvic floor muscles with one channel. We need one channel for one side and another channel for another side. And we have a new probe. It's still just one channel. If you ask them who have the papers, you can see our results. This doesn't work. The integral theory. Peter was amazing. Peter Reichels knew that can help in the surgery. The theory of Peter is very good, but there is some things when we talk about pelvic floor muscles that I cannot understand very well. During the continence phase, what do you have? We have pelvic floor muscle contraction. When we have pelvic floor muscle contraction, we will close ureter, vagina, and anus. This is the only way. Pelvic floor muscles cannot push the bladder back. This is the first law of Newton. This is the inertia. Because we don't have nothing holding the bladder, you fall on the back, but there is no pelvic floor muscles pushing the bladder back. When we have pelvic floor muscles contraction, we will have just one single movement that will close ureter, vagina, and the anus. During the defecation or evacuation, the pelvic floor muscle must be relaxed. We do not have any muscles open the anus. What will open the anus is the pressure of the feces in the anus. When we have pelvic floor muscle contraction, we will close ureter, vagina, and anus. If you contract your pelvic floor muscle during defecation, you close the anus and you'll not be able to defecate properly. So there is no muscles open the anus. Squatting cannot be used to train pelvic floor muscles. Squatting is good for legs, not for pelvic floor muscles. Because if squatting is good for pelvic floor muscles, the athletes will not have any pelvic floor muscle dysfunction, right? But what you can see, they have more problem than regular women. So it's impossible to train pelvic floor muscles squatting. Conclusion. If you have good cables, you have a great bridge. If you have a good floor, you can have higher bridge. If you have a good cable, your boat can be that. maybe for years. If you have a good floor, your boat can go to the water. I believe in prevention because we start to wash hands. You don't have infection in the hospitals. If we can eat better, we can deny the obesity. Because you have a good dental hygiene, the dentists, they're putting Botox in their patients now. I really believe if you can teach the patients, the woman, since a young age, to work out these muscles, how to contract, how to relax, we can prevent a lot of pelvic floor muscle disease. I do not believe we can do this with a chair. If you are looking for a global rehabilitation in the urinary, defecatory, support, and sexual system, you need to have we need to have pelvic floor muscle rehabilitation that you teach your patient the conscience about these muscles. Most of women, they don't understand how to contract and how to relax these muscles. It is not enough. Put them, sit in a chair, and tell them, sit there. We will resolve this for you. We need to learn how to use these muscles. It's not enough to know how to contract and how to relax. We need to understand I need to contract before sneeze, before cough. If I'm running, I need to contract. If I urge to pee, I need to contract these muscles because when I contract the pelvic floor muscles, I will pull your urethra and I will inhibit the parasympathetic nervous system and the purge sensation will stop. We can promote muscle hypertrophy. When we have a good pelvic floor muscles, we can have more pleasure ringside. We can have better orgasm. Why we're not telling this to our patients? This is part of life. This is important, empower the woman. Because this woman, she can be free. She can go to anywhere that she wants. She can jump. She can go to the beach, no worrying. Oh, if I pee on myself. She can have sex, no worrying if I feel something in my vagina. So, I do not believe we can do this just sitting in a chair. Thank you so much. If you want to know more about what I'm doing, this is my book about my treatment. This is my book about my assessment. And this is my book about my project, Liberty and Respect. This is to bring the patients knowledge about their sexuality and how they can live their sexuality with more pleasure. And I have the right on that. Thank you, Michael. Thank you, Anna.